In February of 1994, a 31-year-old woman named Gloria Ramirez was rushed into the emergency room of Riverside General Hospital in California. She wasn't dying in some typical way. She was battling late-stage cervical cancer, and her body was failing on its own terms. But what happened next didn't just defy medical expectations, it defied logic. Some stories sound impossible, the kind you'd expect to be exaggerated or completely made up, but every detail you're about to hear actually happened. No embellishment, no dramatization, just events that unfolded exactly as they did, even when they stopped making sense. This is unhinged, but true. As Gloria was wheeled in, doctors and nurses expected a routine, if tragic, battle against a dying body. Instead, they were met with something no medical professional had trained for. Her skin glistened with an oily sheen. Her breath carried a strange, fruity, almost garlic-like odor that no one could place. And when a nurse drew her blood, it smelled like ammonia, not the chemical scent of chemo, not the scent of infection, but something sharp and unnatural. And then the room began to fall apart. The first nurse to draw blood, a registered nurse named Susan Kane, suddenly complained that her face felt like it was burning. Within moments, she collapsed. A doctor who took the syringe next saw strange manila-colored particles drifting in the blood. Moments later, she staggered and fainted too. Another therapist, Maureen Welch, began trembling so violently she couldn't control her limbs. Within minutes, more hospital staff were showing symptoms: dizziness, muscle spasms, shortness of breath, until 27 people in that emergency room were sick or incapacitated, and 5 required hospitalization. It wasn't a virus, it wasn't food poisoning, it wasn't an outbreak, and it wasn't another patient. Something about Gloria Ramirez made people violently ill. The hospital was evacuated. Patients were moved out into the parking lot. Staff stripped down to their underwear and had their clothes sealed in plastic bags to stop whatever invisible threat was inside. A hazmat team arrived in protective gear and sealed off the emergency room. But every test came back normal. Meanwhile, doctors continued desperately trying to save Gloria. They injected sedatives, antiarrhythmics, even used a defibrillator to shock her heart, but nothing worked. After roughly 40 minutes of frantic treatment, she was pronounced dead. Here's where the story gets truly bizarre. In the days and weeks that followed, the medical world tried to understand what had just happened. An unprecedented investigation brought in specialists from local, state, and federal labs. They examined air samples, blood samples, even the sealed body bag. And yet, no poison, no nerve agent, no infectious toxin was found. No one could explain why 23 trained medical professionals, people who deal with blood, chemicals, and life or death situations every day, suddenly became violently ill from a patient's presence. A theory emerged from the Lawrence Livermore National Laboratory, one of the most respected research institutions in the United States. Laboratory scientists hypothesized that Gloria may have been self-administering dimethyl sulfoxide, or DMSO, a compound sometimes used in alternative medicine for pain relief. In her bloodstream, it could have been converted into dimethyl sulfone, and under the shock of oxygen from the ER and defibrillation, possibly transformed into dimethyl sulfate, a highly toxic agent capable of causing paralysis, respiratory distress, and organ failure. In other words, the very medicine she may have been using to cope with her pain might, under extreme medical conditions, have turned into something deadly. But this theory itself is controversial. Many scientists point out that dimethyl sulfate has never been observed forming inside the human body, and the pattern of symptoms doesn't match known exposure effects. Some experts argue that mass hysteria, a group psychosomatic reaction could explain parts of it. But mass hysteria doesn't explain why trained medical staff, familiar with chemical odors and clinical environments, suddenly developed severe symptoms including paralysis and collapse. Here's what makes this case even more unsettling. During the autopsy, Gloria's body was so badly decomposed that several organs were reportedly too degraded to examine properly, including her heart in some accounts. Her family accused the hospital of mishandling the body, and some even suspected a cover-up. The emergency room itself had a history of hazardous leaks and safety violations, fueling speculation that something more mundane and more sinister was happening. Weeks later, her body was finally buried in an airtight container, still bearing the nickname the press had given her, the Toxic Lady. So what really happened? Nobody knows for sure. The official cause of Gloria's death was ruled as cardiac dysrhythmia due to kidney failure and cancer. But the questions remain. Why did her blood smell so strange? Why did crystals appear in it? Why did dozens of medical professionals fall ill so suddenly? And could a dying human body truly turn into something so dangerous that it made others sick? Some believe it was a freak biochemical reaction. Some believe it was an industrial chemical misdiagnosis. Others think the hospital's old infrastructure played a role, or that the whole thing was misinterpreted. But the most chilling part is this. Even after years of study, no one has ever definitively proven what those fumes were, or why Gloria's presence triggered one of the strangest medical events in modern history. And maybe that's why the story of the Toxic Lady still haunts doctors, scientists, and everyone who hears it. A reminder that sometimes the human body can be stranger and far more dangerous than we ever imagined,